So I guess to start, there is some changes ahead. And what we know is last year we had a legislation change, and part of that legislation change meant that the new legislation has brought in this idea of mandatory support needs assessments. And this is new for the NDIS. So up until this point, participants provided their own information, their reports, their evidence, took it to planning, and decisions were made through the planning process around what supports, reasonable and necessary supports, would be funded. So that is going to change because the legislation brought in this idea of the support needs assessments. And what the NDIA are telling us is that these assessments will start from June 2026. And what will be funded through these assessments are the supports and support needs arising from the impairments that the NDIS has listed for participants. So for those of you who were following last year with the legislation changes, there was actually very little detail in the legislation itself about the assessments. Most of the detail will sit in the rules. And the rules are not yet fully written. They're sort of being written at the moment. And what we're really hoping, in the new year, hopefully early in the new year, is that there will be some consultation on what those new rules will look like. So these new rules will cover the new assessments and the new framework planning. So that's just a term that's being used for how planning will be a bit different after the support needs assessments start.
And there's a bit of a fundamental change with the Act in its wording. One of those is that we're shifting away from reasonable and necessary supports over to reasonable and necessary budgets. How does this tie in with impairment notices, Muriel, and needs assessment?
Yeah, it's a good question, Mark. So, we at Every Australian Counts really feel like participants need to know what impairments the NDIA and the NDIS has listed for you, because that's a really essential piece of information. Because by the time you have your assessment, it will be only those supports that are identified that are arising from those impairments that will be funded. So there's a little bit of a shift there. So it's a really important thing to know what impairment you have listed for you, what NDIS has listed for you. We know the NDIA does plan to send that information out to everyone in something called an impairment notice. So we're really hoping that that can happen sooner rather than later. But in the meantime, we really encourage participants to try to find out your listed impairment through the participant information access request on the NDIS.
Just to clarify, Muriel, what's the difference between a disability and an impairment?
Yeah, look, that's another good question, Mark. Okay, so what the NDIS has defined is 6 impairment categories. So there's a particular disability might fall into one of those categories. A diagnosis might fall into one of those categories, but it's important to sort of have a look at the NDIS website and check those categories and try to understand which one you might fall into, and then try to get that information confirmed through a process.
Yeah, so it might be a little bit less about diagnosis and more about the actual functional impact.
Yeah, we'd love if impairment was defined in terms of functional impact, and we hope that will be clarified through the rules. At this point, it doesn't look like it is. It looks like it's a list of sort of broad impairments, if that makes sense. So things like physical and things like psychosocial, and it might be, there's a list of 6. So yeah. We're hoping there's a little bit more clarity around those categories through the rules.
I think a lot of us are asking for a lot more clarity around the process. Just recapping what we know about the support needs assessment, and a lot seems to have come out of Senate estimates that have confirmed what a lot of us had suspected, in that the shift towards reasonable and necessary budgets, yes, away from arguing about supports on a line item basis, but it also takes away a lot of choice and control in that move towards what the NDIA call as consistency. The support needs assessments, or as other people call them, SNAs, are based on Instrument for Classification Assessment of Support Needs, or ICANN version 6. And the process, it's not necessarily allied health qualification required for this assessment conducted by external training. I think you went through the training yourself, did you, Muriel? How long would an assessment be expected to take?
Full disclosure here, I have done the ICANN assessor training. I'm also an OT, so I'm happy to sort of take more detailed questions as we go, if we have time, around what the ICANN looks like.
Mm-hmm. In regards to like the assessor workforce being sort of disclosed around the people that would be doing the assessments.
So this is what we know so far, and there's still a lot of unanswered questions around the assessor workforce. But what we do know is that the NDIA has indicated an intention to employ quite a big assessor workforce, up to 1,000 people, and that this workforce, they won't necessarily be all allied health professionals. Some of them might be, but what they are looking at doing is having the trainer model. So some initial allied health professionals trained who would then train future assessors. So that's our understanding of what that workforce will look like at the moment.
But just clarifying, like with independent assessments, we didn't have choice over who assessed us, but at least they weren't employed by the agency. So it's like not independent assessments, but we're actually still have no choice over who's assessing us, and they're likely to be employed by the NDIA, and they may not be allied health. Is that correct?
That's our understanding, and that's the information that's been shared sort of publicly recently through various forums.
Sounds pretty concerning. And like they're still just going through the training process at the moment. At Senate estimates, they talked a lot about a number of things still being up in the air and not confirmed, and that we'll have an opportunity to sort of feed back on some of these things in the rules. So it's probably really important that we all start to get together now and start to think about these things and what we will and won't sort of accept in relation to the future of the NDIS.
Yeah, thanks for that, Mark. And I think there's just so much that we still don't know, even though we're starting to get more of a sense because the NDIA have run some webinars in recent weeks. But there is absolutely a lot of questions around the skills, the decision-making expectations of assessors, what will they be expected to do, and how will we know? How can we be confident they actually have the skills to undertake that role?
Just skipping ahead, what is the ICANN and like how does it work?
Yeah, so the ICANN it's an assessment tool. It's been around quite a long time. It's actually been around for around 20 years, and it was sort of built in Australia. It's brand new for the NDIS, however, and this is sort of the first time it's been used in this context. It's been developed for people who are age 16 and over, and it looks at a whole lot of functional domains. So, much more than sort of the 6 domains that we're familiar with in the NDIS Act, although they're all in there too. And so it does cover quite a bit in that regard. What we're being told is that, however, it will be changed quite significantly from its current form before it is used for the NDIS. So this is another source of questions, I think, for a lot of people. We want to know, how is it going to be changed? How can we be confident it still works? You know, for any assessment tool, if you change it, you've got to be really sure that it still works in the way that it did
And
before it was
on the
changed.
multi-billion-dollar question, how is a reasonable and necessary budgets calculated?
Okay, so that comes, I'll step it back a tiny little bit. So the ICANN generates a set of scores. And so for a whole lot of functional areas that someone might have, it looks at how frequently does that person need a support, and then how intensive does that support need to be. So there's sort of a series of questions that generate those scores. And what we understand currently is that those scores will then be used to feed into a formula, potentially an algorithm that then generates the participant budget. So I think a really important point to make, though, is currently the ICANN in its current form, it does allow people with disabilities to bring their own evidence. It allows them to bring their own allied health reports, medical reports, self-reports, a whole lot of information that the person is allowed to bring to that ICANN assessment currently.
We get to
We
see.
don't know if that's going to continue, and there's been some indications that participants won't be able to bring information in many circumstances to that assessment in future.
So, like, we get to see all the information submitted, but like, have they confirmed whether we can actually supply external evidence into the assessment?
They haven't confirmed, and in fact, some of the recent webinars would suggest that that information won't be requested or it won't be utilized. We'd love to have that confirmed, though, and because there may be some particular instances where they do consider particular types of evidence. We don't know if that's going to be participant provided evidence or evidence from another source that the agency might request. These are some of the questions that we still have.
How does the ICANN translate support needs if someone, say, has multiple disabilities and things are quite complex?
That's a really good question, and it's something that we don't actually know. We don't know how these scores are going to be translated into a budget. We don't know if there's going to be other factors taken into account. We don't know if the person's particular disability type or impairment type will be a factor that determines budget, and whether gender, location, those kinds of factors, whether they'll be considered too. So there's a whole lot of questions around how these scores will translate into a budget for an individual. And I know this is a source of quite a lot of questions from the community currently, because what we know is once those scores do translate into a budget, that budget can't be varied by a planner. It can't be changed unless that person goes back and does another assessment again, the same assessment process.
So it could essentially be an endless loop between the tribunal planners and assessments to have our needs met.
That's definitely a significant risk, isn't it? Because what we learned recently is that the ART also doesn't appear to have capacity to vary a person's budget. What they can do is refer that person back for another assessment, but they can't actually alter the total budget amount.
So on using the budget, like, I know that there's been a lot of talk within the representative communities about like flexible budgets is something that the NDIA had sort of promised at the end of reforms. How is like what was sort of discussed differing from like what is likely to be proposed in terms of like flexible?
Yeah, so again, this is something that there will be a rule written about. So we don't know how much of this is already sort of decided and how much of it will sort of be written and worked on with the community as we go. But what we do know is that once the person does go through their assessment, they get their assessment report ticked off by a planner. And once the plan is sort of ready to go, there's going to be a flexible part of that budget, and then there's going to be a stated support part of that budget. And how that works, the mechanics of it, will all need to be written into the rules. So these rules are pretty important, as you're probably starting to get a sense of. They're really, really important, these rules, and really important to get them right, which is part of why
100%.
it's just part of why we really wanted to get people together today, is to start this
The big question that I've got, and like if you slip onto the next slide, is this robo planning. And I know that it's something that the NDIA doesn't want to touch with a 50-foot pole. But my biggest concern is that we don't know what is in the black box in terms of the algorithm and what aspects of our demographics actually like go into the funding decision in terms of is it gender, is it disability, like how are we to actually ensure that this process is transparent and not biased, and that our needs actually get met. Because from what was proposed at Senate estimates, we've got the data that comes in from the support needs assessment from potentially an unqualified assessor, a non-allied health assessor, I'll just clarify, that has done the support needs assessment training, that goes from a semi-structured interview. That data, we do get the opportunity to review it and make sure it's correct in our eyes. But if it's not taking into account like all the evidence from like our families and our allied health teams and the wider sort of network of people that supports us, if the data that's going in is faulty and we don't know what the algorithm is and we're not able to actually amend the budget to address risks and needs, what safeguards exist?
Absolutely. That's the big question, isn't it, Mark? When you combine an unproven assessment process with a group of assessors that potentially haven't got formal training, with a process that we don't know about, we don't understand. There's a lot of question marks really around all of this. And, you know, we really want to work as a community towards finding out some of these answers and hopefully building some of the answers too.
At the risk of sounding like a fat, disabled, angry man, I prepared a slide earlier to sort of summarise the key concerns that I've got in terms of the promise that we were given back at the inception of the NDIS versus what's sort of proposed in terms of the assessment process. And it's likely that other people have different opinions, and that's okay. They may like some things, but myself personally, the NDIS talks about like a simpler and fairer pathway, and I feel that that includes like transparency, and fairness sort of goes along with sort of choice and allowing sort of balance. We've got choice and control as a foundational principle of the NDIS, focus on support needs and a commitment to person-centred planning, accountability and review, and the right to have decisions to reviewed. But with this process that we're seeing in front of us, like the key questions we have are, well, I have are in relation to like robo planning and like what is the actual algorithm, what feeds into it, and like what human discretion is going to be there to adjust like the total amount. Like how is expertise included? I know that when the legislation was going through last year, a number of politicians and advocates strongly proposed for a Medicare line item to be included to allow people to sort of work with needs assessors that actually understood their complexities and people to have a choice over like who was involved in their assessment process. We don't know what's in the black box or the algorithm in terms of like how this data actually translates into like meeting our needs and how it factors in like the real cost of support, and that the support will actually meet the needs of individuals. And also like fundamentally on like procedural fairness principles, when we're looking at the current process, when we're going through to the ART because we feel that something is wrong with how a decision was made, the ART can review a whole person's plan, and the changes that are made in relation to that are then mandated by the agency. And if it fits within the budget realm with the proposed changes, that dollar amount may not be able to be changed. The only option that would exist is for someone to go back, have another needs assessment, which may or may not actually reflect the budget amount required to address that person's needs. The only remit that was suggested at estimates was that the tribunal would only be able to change things within the budget, not the overall amount. But I'm sure that the community has plenty of questions around this. I know I still do. And I don't want to take up too much of their time to or for everyone to have their say.